Did you know that something hiding in your fridge could actually be deadly? A tiny bacterium that survives even in cold temperatures. Today, we're talking about Listeria, where it starts, how it spreads, who's most at risk, the symptoms, treatment, and most importantly, how you can protect yourself and your family. Stay tuned until the end, because I'll share 7 simple tips that could literally save lives. What is Listeria? So, what exactly is Listeria? Listeria, or Listeria monocytogenes, is a foodborne bacterium. Unlike most bacteria that can't grow in cold, Listeria can actually survive and multiply inside your refrigerator. That means even foods you thought were safe in the fridge could become contaminated. Where does it come from? Most often, Listeria starts with contaminated food. This includes unpasteurized milk and dairy products, soft cheeses like feta or brie, deli meats and hot dogs, ready-to-eat meals, and sometimes even fruits and vegetables. In the United States, you'll often see news of companies recalling their products because of Listeria contamination. And it's not just a US issue. This bacteria is a global threat. Who is most at risk? Technically, anyone can get sick from Listeria, but certain groups face a much higher risk. Pregnant women, because it can cause miscarriage or premature birth. Newborn babies, whose immune systems are still developing. Older adults, especially those over 65. And anyone with a weakened immune system, such as cancer patients or those on specific medications. Symptoms of Listeria infection. Let's talk about the symptoms. In the beginning, they often look like regular flu. Fever, headache, nausea, vomiting, and muscle aches. But if Listeria spreads into the bloodstream or brain, things get dangerous. It can cause stiff neck, confusion, loss of balance, or even seizures, leading to meningitis or sepsis. And here's the tricky part. Symptoms can appear days or even up to 2 months after eating contaminated food. Diagnosis and treatment. Doctors usually confirm Listeria with blood tests or lab cultures. If it's a severe case, treatment involves antibiotics, most commonly intravenous ampicillin, sometimes combined with other medicines like gentamicin. Pregnant women and newborns need urgent medical attention if infected. Remember, only a doctor can decide the right treatment, so if you suspect exposure, seek help immediately. How to prevent Listeria. Now let's get into the most important part, prevention. Because prevention is always better than cure. Here are 7 proven ways to stay safe. Always use pasteurized milk and dairy products. Avoid soft cheeses, deli meats, and hot dogs if you're pregnant or in a high-risk group. Keep your fridge clean, wash shelves weekly, and wipe up spills immediately. Separate raw meat from vegetables and ready-to-eat foods to avoid cross-contamination. Cook food thoroughly so heat reaches the inside and kills bacteria. Real-world example. In recent years, the US has seen several recalls of ready-to-eat salads, pasta, and deli items because of Listeria contamination. Sadly, some outbreaks have even led to deaths. This is a reminder that food safety isn't just about taste. It can be a matter of life and death. Special message for US viewers. If you're watching from the US, make sure to follow FDA, USDA, and CDC alerts. Check grocery apps like Instacart or Amazon Fresh for recall notices. Deli meats and ready-to-eat foods may seem convenient, but they need extra caution. Closing line. Protect yourself. Protect your loved ones. Sometimes the smallest precautions save the biggest lives. Thanks for watching, and take care.